When should you stop your child's ADHD medication? It could be almost a question, when do you start or when do you stop? And I've had a few queries recently from some of my patients that have been on medication for a while, and their children are doing so well, doing so well academically. And sometimes, you think to yourself, well, do they really need the medication? And it's an interesting question. And I don't think there's any one particular rule that fits all. It's not that at a certain age you've got to stop the medication. They've got to be on it for 2 to 3 years. Every child is different. So when should you think about stopping the medication? And I'm not really talking about cases where your child is probably having side effects and you want to minimize the use of medication. With ADHD, it's an immaturity of the front part of the brain called the frontal cortex. It lacks the control and the self-control. And I like to think about it as it's lacking brake fluid, that inability to control self-control. Children with ADHD are often a little bit immature. They have an executive age, and there was a self-control age that is behind what is expected for the actual age. So what you've got to think about in deciding whether your child needs or can stop medication, you need to be kind of not only just focused on the exam results or test results, or like a lot of parents receive school reports, and you are basking in the glow of those wonderful results. And academically, things are doing well. Maybe it's because your child is on medication. So one of the things that I thought I would talk about is thinking about, at home, answer the questions, even though your child's taking the medication. There might be on occasions when parents don't give the medication during weekends, or they don't give it during the holidays. When your child wakes up, do they need to have a lot more organization? Are you constantly chasing them? Difficulty with getting ready, dressed, you constantly at them. They're forgetful, they're leaving things. They left their towel again on the floor in the bathroom after you asked them 15 times. You find them leaving kind of things, losing things. You go out, you've got to constantly check them. They come home, they leave things out. You ask them 4 times, they don't do what you ask them to, because they lack what we call working memory. It's like the RAM on your computer. They can't keep in mind things long enough to remember, not because they're trying to be obstinate and difficult and defy you. That's not what they're trying to do. They just can't remember. It's not a problem of I won't, it's a problem of I just can't. Not an excuse. But think about it, kind of objectively. Children don't wake up and try to define and make your life difficult. So if you've noticed that your child is more organized, you're finding that your child doesn't really need those reminders, even when they're not on the medication. They're more organized in the afternoon. They seem to have matured. Then that is a reasonable time to think about it. But when you stop the medication, remember, it's not as though your child's ability is going to suddenly fall back to where they were. Often parents worry about that. It's not like a helicopter with the helicopter rotors that switch off and it crashes down. It's not quite like that. If you stop the medicine, there's still going to be that growth, that kind of benefit that the medications afforded the maturity. It's going to take several months before it actually kind of decreases. So you're not going to see the difference today. Parents often think, well, if I don't give the medicine today, they were fine today. The teacher didn't seem to moan or have any problems, and they had a kind of good day. It's not an indication that you should stop the medicine. This is something you need to think about very carefully and objectively. Do you want to undo what your child's achieved academically and organization? So, as your child grows, some of the things that you can think about, if your child grows and the medicine's kept the same, they're kind of outgrowing the medication. They are technically weaning off the medication. Sometimes when parents worry, do I need to give the medication? I just want to get rid of that medication. And I think sometimes it's a bit of a subtle sort of grudge you've had with that and a struggle you've had with the medication. But before you suddenly decide to stop the medicine, think about your child needing glasses. ADHD is a genetic condition. It is something that is a neurochemical problem. If you need the glasses to see, you should keep giving them. It helps your child think clearly. So before you decide to stop the medication, think about the consequences. Sometimes a trial of medication during weekends and holidays, and observe, is your child together? Are they independent? Can they remember things? Are they self-organized? Is there a maturity that you can see? Then it's not a bad thing, but discuss that first with us. So, when you decide to stop a medication, try to do it in conjunction and in discussion with the teacher and your pediatrician or the person that's prescribing it. The teacher can often tell you very quickly, the days that your child's on medicine, and it really does help. And of course, we're not there in the classroom. So it has to be a collaborative discussion before that decision's made.